focus of discussion today is all about obesity. What really is it all about? What are the causes and how can we be able to manage this condition? And why is it that we are seemingly seeing what you'd call an increase in the number of persons who are obese? For more insights on that, we are now joined by Dr. Daniel Githinji. Thank you very much, Dr. for coming to our studios.
Yes.
We always like to begin with the numbers. In terms of statistics, what does the situation look like in terms of obesity? How many people in Kenya would you say are obese?
Okay, I can say that 20% of Kenyans, they are obese. 65% they are overweight.
So how do you measure, obesity?
It is about your height divided by your weight. That is BMI, body mass index. That's why you know whether you are overweight or not. You know you need to be 18.9 to 29.9. Then if you are over that, you are obese, you are overweight. Now it's 31, 32, like that. If you are 34 to 54, that we can say you are obese. We see that the age of 35 to 50, that is where you can see a number of people are obese.
What are some of the causes of obesity?
Obesity is about lifestyle, the way you live, the way you eat. What you eat make your body the way you are. And the way you handle things. When you have a problem, the way you handle that thing. That's why, like for instance, you have depression, you can handle it. Insomnia, you can handle it. Diabetics, you take more insulin. You have a problem with thyroid, that these are hormone. You can have problem with weight.
What are some of the risks to those people who have this condition? Okay,
we can say if somebody is obese, you can have problem with arthritis, blood pressure, blood sugar. For women, we can see that gyno problems and infertility, both for men and women. But for women, we can say that 3% of women, they can have that because of obesity. Yeah. About reducing weight. Before you think to reduce weight, number one, it's to attend, you see the doctor, a certain test to be done. We check the rate of metabolism, the way you absorb. Do you have another condition that is factors that's causing to gain weight? If your condition that is causing your weight is protein metabolism, and you're learning, you are skipping meal, you are using gym, how are you going to deal with that metabolic problem? Or insomnia? You are overweight because of insomnia. And you are learning the law just doing exercise.
So how do you take care of that particular problem?
Number one, if you know the cause of the weight is protein metabolism, repeat metabolism. If it's protein metabolism, you deal with the protein metabolism, the weight start reducing automatically without bothering to take anything for reducing weight. If it's repeat, then you deal with repeat.
Junk food. We keep talking about junk food.
Yes.
Why is it then that junk food is cheaper than healthy foods, if indeed we are serious about trying to promote the health of people?
You know, nowadays the youth, they don't want to eat the healthy food. They want to eat something that sweet, a lot of fat things. You can eat junk food, but not always. Yeah, not always. You can eat, then you take more water, because also water helps to reduce weight. But if you have to eat that once in a week or once in a month, so that for you are healthy. For now, you might not see the risk right now, but some years you'll start experience some risk, like heart problem, cholesterol, high cholesterol, blood viscosity. You have myocardial problems. So to avoid that, it is good to avoid taking those junk food. So about the weight, we need to do awareness, the way you eat. Also, the way you behave.
Okay, as we wind up the program, what would be your message perhaps to the Kenyan people who are watching you right now in terms of dealing with obesity? What should they do? The do's and don'ts.
Number one,
obesity.
To reduce weight, it is first of all start with a simple thing. Take water every day. Like for instance, you are 100 kg, divide by 30, then you'll get how many liters do you need per day. Your weight divided by 30. 8 glasses of water a day.
Yes.
That is for normal person with normal weight. That water help to cleanse the body, number one, help to reduce weight, help to remove toxin in the body. The other thing, visit the doctor. Yeah, that's when you have to visit the doctor. Yeah.
All right, we've run out of time, but thank you very much, Dr. for your insights and perhaps sharing with us what are some of the simple things that we can do to try and fight with the problem of obesity and being overweight.